So, okay. So Dr. Servis, please discuss your core responsibilities as Residency Director at UC Davis and how you have evolved in that role over the 21 years that you have served in that position.
Wow. Well, Residency Training Director, you have responsibility for the selection of residents to the program, which is a big part of the job. It's one that over time I've appreciated more, that your program will only be as good as the residents that you get, and so having a selection process that finds the best residents in terms of fit for your program is a very important part of the job. And it's also one that requires the coordination of both your residents and your faculty members and your staff. So recruitment occupies a good chunk of my activity, especially this time of year. We're just wrapping up our recruitment season. And overseeing the ranking process, which is always a very challenging and interesting process for programs. And then the things that more commonly you think of as responsibilities of a training director are curriculum. And programs have both a formal curriculum in terms of seminars and didactics and case conferences and lectures that as a training director you have responsibility for coordinating that. And for each year there's typically a different set of didactics, conferences, etc. But you also have responsibility for the clinical curriculum, that is the rotations that the residents are going to have in your program, and working with the faculty at various sites to try and ensure that they're getting a really wonderful training experience, that your residents are really getting the clinical experience and supervision that they need. And then the other piece that is a big chunk of residency training is the assessment or evaluation of residents, and ensuring that you've got a comprehensive, integrated, fair, and effective evaluation system, which includes the evaluation of residents' clinical work on rotations, evaluation of their work in formal didactic settings, formalized examinations like in training, written examinations, clinical assessments, like we currently have the clinical skills verification requirement from the board that is observing residents doing live patient interviews and ensuring that they meet competencies in the doctor-patient relationship, history-taking, presentation skills. So when I think of residency training, those four pieces are the big pieces: selection of residents in the recruitment process, curriculum, clinical curriculum rotations, and then the evaluation and assessment piece. So, and you asked about over 21 years, how it's evolved for me. I've learned to delegate more things. I've learned to work with the residents and the faculty in addressing how to have the best curriculum, how to do a good job with recruitment, and even how to do a good job with evaluation and assessment. I see it, when I started out, as something I took on a lot of the responsibility for these things on my own, and I've learned over the years to be much more collaborative and working with colleagues and with the residents themselves to accomplish these things.